Uganda is in the news again for the nodding syndrome that was first reported in 2009. Nodding syndrome is a severe neurological disorder that manifests as seizures, head nodding, cognitive impairment, multiple disabilities, and affects children between the ages of 3 to 18. In 2012, the Ugandan government started its intervention to curb down the nodding syndrome, which had already claimed more than 100 lives in the northern districts of Kitgum, Padya, and Gulu. However, recently, there have been reports in various media that the disease is on the rise again, and this has sent shockwaves among Ugandans. Now, the Ministry of Health claims that the media has blown this out of proportion.
I would have expected that the media person would have been objective in his reporting. He only focused on the 5% severely ill patients with brain damage. He did not focus on the others. How could he not focus on the 25% that went back to school?
While addressing the media, Dr. Ruth Aceng, the Minister for Health in Ugandan government, said there were no new cases and that people are confusing epilepsy attacks with the nodding syndrome.
From our statistics and reports from the districts, no new case of nodding syndrome has been reported since commencement of interventions against nodding syndrome in 2012. New cases that have been reported as nodding syndrome have turned out to be cases of epilepsy and sometimes febrile convulsions after verification and classification by the trained health workers.
The minister further explained that the worm that is responsible for the nodding syndrome is also associated with epilepsy. According to Minister Aceng, current data indicates that there are 2,083 nodding syndrome patients in the entire region.
Trained specialists from Gulu Regional Referral Hospital have been following these cases in addition to regular visits by health workers from the districts. We continue to carry out surveillance and search for those who may not have been identified and registered.
Many victims of this disease live in isolation. One of the victims' mother tells a story of how her son caught the syndrome in 2007. But last year, it became severe that the victim got burnt when the mother had gone to the garden. Burns, malnutrition, and drowning are major causes of deaths in nodding syndrome victims.
Anda winya ka dana ma wiru ti ka dange dana mo te gang me ti kwe bi la santo porike anda chauri ya bia no atiano do porike ngata do yuai do no si do wang kan wai kan do wang do da chauri sa ka kenyo.
Uganda has since 2012 lost more than 137 children to the syndrome, with the latest case being 2 weeks ago in Padya district. The victim drowned in a river. Padya district has had the highest death rate, with 81 children reported to have died since 2012.
Kitgum General Hospital, being a referral center, receives very ill patients who usually arrive in the late stages and severely ill. Moro district registered 9 deaths between 2015 and 2017, while Padya district has registered 81 deaths to date, of which 6 were at the health facility and the rest in the community.
While media reports could be wrong about the new cases, it was accurate about the misappropriation of funds by district officials. Of the 1.8 billion shillings sent to northern Uganda to fight the syndrome, 237 million is unaccounted for, yet government is sending in more money. The minister says district chief administrative officers and chief finance officers have been asked to account for all the monies sent to them.
Accountability for the funds has been poor, with over 237,396,000 Uganda shillings unaccounted for. Kitgum district is the biggest defaulter, with over 109,311,860 million shillings not accounted for, followed by Lamu district.
The ailing condition of the public healthcare system in Uganda is one of the major concerns for most people when it comes to dealing with outbreaks such as the nodding syndrome. Activists have routinely complained about the underfunding of Uganda's health sector, to which just 5.3% of the budget is devoted, far below the 15% that the government committed to allocate to health under the Abuja Declaration. While stories of money disappearance is not uncommon, it remains to be seen what the ministry will do in the case of funds meant for the fight of this uncanny disease. Sarah Bidiomisho for Hotshot News.